Hello, and welcome to the AskCHIS online tutorial on creating data displays and graphics within AskCHIS. In order to get started, you'll need to navigate to the AskCHIS web tool and develop either a univariate or a bivariate data table. In this case, we've already developed a bivariate data table in our previous example and have it here to use. You'll notice that we have a few different options over here on the left-hand side related to data displays. Go ahead and start with our first data display option, which is a bar chart. This bar chart is particularly useful for this example because we can see huge differences between those who do and do not have a usual source of care by health insurance type. We also have the option for a pie chart, and what I love about the pie charts in the system is that as you scroll down, you'll notice that every single health insurance has its own pie chart. So depending on what your main topic is, it will be sorted by that secondary compare by topic. And so it makes it easier to pull out key pieces of information versus have one very large, complicated pie chart to look at. The other option that we have is a trend graph. You'll notice that the trend graph will take about 10, 20, maybe 30 seconds to load at the most. And at some point, it will ask you specifically to tell it what you're looking for. So you'll need to choose one of the data variable levels. In this case, you will notice that it's asking me to choose insurance type. And I'm most interested in seeing the plight of the uninsured and underinsured, so I'm going to go ahead and select uninsured and choose show trend line. And you'll notice that this graphic is interesting. It does show me that those who have a usual source of care is a slightly higher percentage than those who don't, but overall it's very close to 50-50 between those who don't and do not have a usual source of care for those who are uninsured. What might be more helpful is to see across insurance categories. And we do have that option. So if we go back to the data table, we have the ability to adjust the layout, remember, and transpose those topics. When we do that, it provides us a different data table, and it also generates the charts and graphs in a different manner as well, right? So this compares groups across insurance categories under the bar chart. And same thing here for the pie graph. Instead of providing us a separate graph for each insurance, it provides us a separate graph for whether or not you have a usual source of care. So next, under trends, you'll notice that it's going to ask me a different question. Instead of choosing an insurance type, I get to choose has or does not have a usual source of care. You'll notice in most of the examples, I will always choose the negative consequence, right? The lack of performance, the lack of access, the lack of appropriate care. And the reason we do that is because we want to understand that burden in society. So I'll go ahead and select does not have usual source of care. And I'll click show trend line. And you'll notice that to me, at least, this data is more impactful. What it shows us is those who are uninsured do not have good access. But you'll notice this trend is actually turning downward, giving the impression that access is improving, possibly because fewer people are uninsured, hopefully. However, you'll notice Medicaid and employer-based health insurance also contains folks who are reporting not having a usual source of care. So that's interesting and maybe something you might be interested in digging into a little more deeply. Thank you for taking the time to listen to our brief tutorial on data displays and graphs and charts within AskCHIS. I hope that this was helpful, and I hope that you're able to find the data that you need and are able to display it in a meaningful and impactful way using these tools. Thank you and have a great day.